Another challenge we have is with the new universal health care programs. His Excellency the President had a lot of program in matters health in this country. And as you are aware, UHC has been tried by the successive administration from 2002 until last year. This project has been now actualized, but with a lot of challenges. Challenge number one is a simple example. This county, the way the board member was explaining here, this county teaching and referral hospital has an outstanding claims of close to 100 million Kenyans with SHA. This is the facility that has casual staff which need to be paid. This is the facility that has suppliers to be paid. This is a facility that needs continuous maintenance. With an outstanding balance of close to 100 million Kenyan shillings as outstanding claims, the most unfortunate thing is the last disbursement. SHA shamelessly sent 784,000 Kenyan shillings. How can you send 784,000 Kenyan shillings to a facility like Mandera County Teaching and Referral Hospital? I think this is a joke. So there are people who are supported in this program. And I want to call upon the Minister for Health. I know you have a lot of challenge because you have been taken to a place called Mafia House. And we are doing a good job. But you cannot pretend to be financing the health care. You cannot talk of universal health care when a referral hospital like this hospital can get a disbursement of 700,000 shillings out of the 100 million outstanding revenue. I think they must do something. I want to call upon SHA and the ministry to urgently and immediately release outstanding claims for this facility and all the other facilities across the county. Because we can't continue providing services for free. We need to supply medicine. We have just received our supplies this week from KEMSA. They need to be paid. There are back orders because we have to order what KEMSA don't have. We can't even order because there's no money. So our appeal to His Excellency the President, this scheme is also being supported and it's destined for failure. So we need an urgent release of funds to the facilities. They have been talking of verification. Why can they verify and then if there are issues, they keep aside and release the balance? Because out of the 100 million, they have already queried about 19 million. So you want to say my missing invoice, to do what? And identity not form not proper. Those are administrative issues. It can be addressed. But why can't you release some money so that this hospital can continue service in the community? Because over 500, this hospital attends to over 500 patients every morning, every day. Exclude the maternity service, which an average of about 30 per night or per day. And then the theater, we have 4 theaters fully operating. The ICU, and yet you send 700,000 to do what? You can't even pay the casualties. So tunawaomba waziri, tafadhali wache mchezo. If these services cannot be funded, then they tell us so that we go back to our old system. Kuna maneno ya kusema there are frauds in Mandera County because Mandera County has been hitting headlines for all the wrong reasons. Because when they are registering private facilities, they don't refer to the Department of Public Health. Because it is done in Nairobi, they have the stamp for public health officers, they forge their signatures, and then they conclude with the medical board and the COC, the Clinical Officers Council. Kwanza hiyo imekuwa scam kabisa. Because within a span of 6 months, the registration of public-private health facilities in the county actually hit close to 550,000. Not 50,000, 550 facilities. we have supported them in doing verification. We supported them. Actually, we facilitated them in doing the verification. From their report of verification of about 538 private facilities, 182 were crossed. 197 downgraded to level 2, which is as good as closed. So close to 380 facilities were closed. So that we already have assisted them in fighting the fraud. But the problem is, how do you register a private facility without an inspection and confirmation from the public health department? And you register today and then start paying the following day. You cannot victimize public facilities because the private facilities are doing fraud. It is your responsibility to fight fraud. It's not our responsibility. It is you who register. It is you who pays. Don't transfer your problem to us.